Hi everyone. In this clip, I will talk a little bit about collapsed lung. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. So collapsed lung happens when the air gets inside the chest cavity and creates pressure against the lungs, causing it to basically collapse either partially or fully. This is also called pneumothorax. So this can happen because of a chest injury. It can happen because of a certain medical procedure, an initial underlying lung disease such as, let's say, asthma, COPD, emphysema, lung cancer, tuberculosis, or pneumonia, and more. Also, air blisters sometimes can develop on top of the lungs, and when they burst or rupture, they let the air sort of to leak into the space around the lungs. Or sometimes this can happen for no evident reason, for no obvious reasons. Symptoms usually can include things like sudden chest pain, shortness of breath, bluish nails or lips or skin, coughing, fast breathing, or fast heartbeat, shoulder pain, lightheadedness, or feeling like fainting. On some occasions, a collapsed lung can also be very life-threatening. To diagnose collapsed lung, your healthcare provider may ask for x-rays or CT scan or EKG and more. Treatment for this usually involves inserting a needle or chest tube between the ribs to remove the excess air. This hollow tube is sort of inserted between the ribs and is attached to a suction device to remove the air in the pleura space. Once the chest tube is inserted, it typically takes about 48 hours or so that the lung can heal. However, a small pneumothorax may actually heal on its own. So the doctor may also take blood from the arm and put it into the chest through a tube, and this makes a patch on the lung that stops the air leak. The person may receive supplemental oxygen therapy to speed air reabsorption and lung expansion as well. So if the collapsed lung is because of pneumonia, usually in 1 week, the fever should be gone. In 4 weeks period, the chest should feel better and produce less mucus. At 6 weeks, the cough sort of subsides and it's easier to breathe. And in 3 months, all the symptoms should be gone, but the patient may still feel a bit tired. All in all, it usually takes 1 to 2 weeks to recover from a collapsed lung. But the person has to wait for the doctor to say they're okay. And until then, they need to go back to their routine little bit at a time. Let's say go for walks or do other very low impact activities. Monitor their symptoms, like watch for chest pains or other signs that may show that they have not healed yet, like let's say fever or coughing up a little bit of blood. Lift only light objects. Don't pick up anything heavier than, let's say, a gallon of milk. Don't vacuum or mow the lawn or shovel the snow. Be careful how you exercise. Don't do anything that jars the body, like, for example, running or biking, and of course, contact sports. Don't do any of that. Remember air pressure, right? Don't get on an airplane until the doctor gives you the okay, which is usually about 3 weeks after the lung has been repaired. Some vitamins and supplements are quite helpful with lung health and recovery, including vitamin C, vitamin D, vitamin A, vitamin E, as well as magnesium and omega-3 fatty acids. However, please ensure to consult your healthcare provider before taking any of these supplements. Vitamin C protects against basically shortness of breath mucus and wheezing. Vitamin D helps with other lung conditions and improves the quality of life. Vitamin A, E, magnesium, omega-3 fatty acids, fish oil, and I usually recommend krill oil, and curcumin are also important during the healing process. Now, there are some drinks also that can be beneficial during the healing, like green tea, which is rich in antioxidants and that are sort of anti-inflammatory and have protective effects on the lung tissue. There's turmeric milk, which has anti-inflammatory properties and helps reduce lung infection and inflammation. Warm water with lemon, which is a good source of vitamin C and can sort of support lung health and boost the immune system. Honey and warm water to soothe the sore throat and cough, and it will provide a level of relief from discomfort, as well as things like pineapple juice, beetroot juice, or garlic-infused water. Metaphysically speaking, a collapsed lung could be interpreted as a symbolic representation of a person feeling stifled, unable to breathe freely due to emotional burdens, suppressed feelings, or feeling lack of sort of personal power, potentially linked to themes of grief, trauma, or sense of being overwhelmed by life's pressure, essentially a closed-off emotional state, hindering their ability to fully express themselves or engage with the world around them. The key points to consider: in spiritual traditions, breath is seen as a vital life force, of course. So a collapsed lung can symbolize a feeling of losing vitality or a sense of being disconnected from one's life energy. The lungs are often associated with letting go and releasing emotions. A collapsed lung might represent holding on to negative emotions too tightly, preventing emotional release and causing internal pressure. The physical sensation of a collapsed lung can be quite frightening, which could metaphysically sort of represent a deep-seated fear or anxiety that is constricting the person's ability to breathe freely. In some interpretations, the lungs are associated with the ability to speak one's truth. A collapsed lung could symbolize a feeling of being silenced or unable to express themselves sort of authentically. The lungs are the organ that is most connected to the emotion of grief. The lungs interact with the outside world, breathing it in and letting it go. When we do not let go of our grief, it's almost as if it can fester in the lungs, causing congestion and exhaustion. In order to care for the lungs physically and spiritually, practice breathing deeply and ensure you're giving yourself the rest your body needs. So keep your body warm, especially in the colder or windier fall and winter season. Spend more gentle, loving time with yourself and any grief that you may be experiencing, and consider sort of adopting a ritual or talking to a friend or a counselor or however else your body and your mind need to sit with whatever you may need to release. Hope this has been helpful. Like and follow for more. Be the light.